doctor of physical therapy for 18 years. Years ago, I became a certified orthopedic manual physical therapist through the American Physical Therapy Association. That basically requires an additional certification and training, about 2,000 hours. Joints, muscles, all of the functional movements of the body. As a physical therapist, that's our thing, is that we work on the diagnosis and the treatment of movement dysfunction. As I see a lot of individuals with orthopedic manual disabilities and dysfunctional prevention. So anybody that's concerned about, seeing a neighbor or a friend or relative that has had problems, we can always prevent things, which is the best kind of therapy. A lot of TMJ, a lot of headaches, a lot of cervical genic headaches, a lot of neck pain, spinal, thoracic, shoulders, elbow, wrists, tennis elbow, golfer, do it all. The back, the hips, the knees, the ankle. Where you got a joint, anything that the muscles are moving, we're working on it. So it's the whole body type thing. It's not just, we're tunnel vision. It's how does this all work together as far as the kinetic chain and the whole joints and muscular system.
So what are some common symptoms that people can recognize to help them understand when they need to go to physical therapy before there's a problem?
Yeah, I always tell my patients, give it a week. If you wake up one day or you were doing, a weekend warrior type thing and you've got some body aches, give it a week, see if it loosens up, if it works itself out. Into that second week, that's when I tell my patients to come in and just ask us, hey, what do you think? What's going on? If it goes longer than 2 weeks, we start to have more compensations that take longer to get out of there. Your body starts to realize, hey, maybe this is the new norm and I need to start functioning accordingly. So if we can get ahead of that or prevent that from happening, those compensatory movements, emotions and stuff, that we can help.
Yeah, so that's actually one of the problems that YPT is trying to solve is there's kind of a stigma around physical therapy that you only go if there's a problem.
Right.
And when there's a problem and when you get referred by a doctor.
Idaho is a direct access state, meaning that you can walk off the street and we can assess, diagnose, and say, hey, this is something that physical therapy can help, or no, I think this is a diagnosis that we need you to go to see Dr. So-and-so at a different specialty. It's the insurance part that says, hey, we'll reimburse you with or without a doctor's script, which just depends on the insurance. But yeah, coming in, I'd love to talk to people and say, hey, this is something we can definitely help with, or no, this is something. A lot of times patients just don't have that information. They don't know where to go.
Yeah.
And so being that point of contact and that entry point into the medical professions, we can help with that. First appointment is just evaluation, consultation. We do a lot more assessment, exams and testing to make sure that we're not missing anything. It's very thorough, so we check the neuromuscular, we check the nervous system, the vascular system, we check all of the systems to make sure that we're not missing anything, if there's any differential diagnosis, so they're there. And then we do a little bit of treatment towards the end, a lot of education to try to get the patient to understand what's going on.
You offer free consultations? Okay, so anybody can walk in off the street, you'll give them a free consultation, no charge.
With insurances, we definitely work with those that have a cash pay option. We provide an athletic package for the high school kids that are going to be here just a handful of times, just to keep things from getting out of control. And then the free consultation. As you feel like you want to improve, there's got to be a desire there, because we can only educate and do so much. It's the patient to buy in and their willingness to do it, and just the enjoyment that they have with the function of life. Again, we'd rather see them have the right information than try to push through the pain and become worse. Come talk to us. We're more than willing to talk and to help individuals. We love what we do, and we feel like we can help quite a bit. There's always something we can find, but it's something that if it's not broke, don't fix it type thing, but we can always prevent it from happening.